Welcome, doctors. We're diving into an essential part of your practice that often gets overlooked, medical coding. Now, some may think of it as just a support function, something that sits in the background. But the truth is, it plays a much bigger role, especially when it comes to your revenue cycle management. So, let's talk about why this is so important for your practice's financial health. Medical coding is the bridge between the care you provide and the payment you receive. It's all about translating patient care into standardized codes that insurance companies understand. Without accurate coding, you're setting yourself up for payment delays, claim denials, and compliance headaches. But when coding is done right, it can mean faster reimbursements and fewer administrative issues, letting you focus on what you do best, taking care of your patients. Imagine this. The revenue cycle starts when your patient books an appointment, and it ends when you receive payment for the services provided. Medical coding connects these two stages. It takes the diagnoses, treatments, and procedures that you've documented during the patient's visit and translates them into codes that can be submitted to the insurance company for reimbursement. If those codes are accurate, your claims are more likely to be accepted the first time around. This means you get paid faster, and your practice's cash flow stays healthy. But what happens when coding goes wrong? Well, errors in coding, whether it's using the wrong code, missing information, or incomplete documentation, are one of the leading causes of claim denials. And we all know that claim denials can be a nightmare. They waste your time, create frustration for your team, and delay the money your practice depends on. But when medical coding is handled properly, those problems are minimized, and you avoid the extra work of resubmitting claims or dealing with rejected payments. Compliance is another critical area where medical coding plays a major role. Incorrect coding can lead to audits, fines, or even legal action. In today's world, healthcare providers are under increasing pressure to comply with complex payer guidelines and government regulations. Getting your codes right the first time reduces your risk of falling out of compliance and facing those costly consequences. Now, let's talk about something a little more forward-thinking: financial forecasting. The data collected during the coding process gives you valuable insights into your practice. It helps you understand trends in procedures, payments, and even claim denials. This data is critical when it comes to making decisions about your business, from budgeting to planning for future growth. Accurate coding leads to more reliable financial reporting, so you can make smarter, data-driven decisions for your practice. But here's the thing: medical coding is hard. It's complex, with thousands of codes that need to match the correct diagnoses and treatments. Plus, those codes are updated regularly, so your team needs to stay on top of the changes. There's also the issue of staffing. Finding trained coders isn't easy, and they're in high demand. Then there's the pressure of high patient volumes. Manual coding can lead to burnout, and when that happens, mistakes are more likely to slip through the cracks. So, what's the solution? Many healthcare providers are now turning to outsourcing to solve these challenges. Outsourcing medical coding to a trusted partner like Staffingly, Inc. can make a huge difference in your practice's efficiency and bottom line. When you outsource, you gain access to certified experts who specialize in coding for a wide range of specialties. That means you don't have to worry about finding and training coders yourself; they're already part of the team. And let's not forget about the cost savings. By outsourcing, you can save up to 70% on staffing costs, reducing overhead without sacrificing quality. Plus, the speed and accuracy of outsourced coders mean fewer errors and faster processing of claims, which ultimately leads to quicker reimbursements for your practice. Outsourcing also gives you the flexibility to scale as your practice grows. Whether you're a small clinic or a large hospital, outsourcing adjusts to your needs without the headaches of hiring and managing an in-house team. And, of course, by freeing up your staff from the burden of coding, they can focus more on what they do best: delivering excellent patient care. So, what did we learn today? Medical coding isn't just a background task, it's at the heart of your revenue cycle management. The accuracy of your coding directly affects your cash flow, compliance, and overall operational efficiency. By outsourcing medical coding to a trusted provider like Staffingly, Inc., you can eliminate the stress of managing in-house teams, reduce errors, speed up reimbursements, and ultimately focus more on providing high-quality healthcare to your patients. Thanks for watching, and if you're ready to streamline your coding process,
if you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.